Hi, everyone. Welcome to another episode of Tattoos and Telehealth. My name is Nicole Baldwin. This is my friend and colleague, Kelly White. We are both board certified nurse practitioners, and we're just having some girl time, just chatting about things. And today we wanted to talk about how to best prevent RSV, the flu, all the things. We are both seeing a significant increase in illnesses, and so we just want to touch on those things today. So I'll let you get started, Kelly.
Wonderful. So our attorneys make us say that this is not considered medical advice. This video does not constitute a patient-provider relationship. So we're just here to chit chat. Um, yeah, so like Nicole was saying, I have seen, so there for the longest time, I was seeing a lot of COVID and it, really wasn't terrible, but I just saw a lot of cases. I'm seeing a ton of flu come through right now. And Nicole, I don't know what population of patients you're seeing with the flu or what symptoms that they're experiencing, but what I'm seeing, unlike what we've seen in past years, the flu used to be high fever, nausea, vomiting, like you couldn't even get out of bed fast enough to throw up, like you just were vomiting all over the place. And this would go on forever, seemed like. I don't see a lot of vomiting right now. I'm just seeing a lot of really high fever. That's the key indicator. Some cough, some upper respiratory junk, and just significant body fatigue, just overall body aches and pains. But that high fever and body aches, that's the dead giveaway. That seems to be what I'm seeing. And then a ton of RSV, unfortunately. Flu A is the bug that I see right now. The great thing is they now have those over-the-counter test strips that you can get COVID, flu A, and flu B. So you can do that yourself at home. And that makes our world so much better because in telemedicine, they can just show up with their little positive test strip and be like, here, I'm positive. And we can get them treated pretty quickly. But one of the things that I want to hit home with is when a patient comes in with the flu, we need to be sure we're treating their partner with prophylactic Tamiflu as well. Um, they're either going to get it, they've been exposed to it, they need to be on it because flu is so contagious. The flu is so contagious. And what a lot of people don't understand is that Lysol doesn't kill a lot of stuff and it doesn't kill RSV. So if you have RSV in your home and you're just Lysoling everything down, you're not killing it. If you're using little Lysol wipes, you're not killing RSV. So if you have a kiddo in your home, you have elderly people in your home, and they have RSV, spraying Lysol and wiping things down with Lysol is not getting it done. You're going to need to use bleach or vinegar, combination of one or the other. Cavi wipes if you're in healthcare and you have access to Cavi wipes. But yeah, just using Lysol doesn't get the job done. So is that kind of what you're seeing right now?
Yeah, exactly. Not a lot of some of the symptoms that I'm seeing a lot of is the sudden onset, like sudden, like I was good 5 minutes ago and now I'm not. And that's very, very indicative of a flu, of a viral attack. And
Yeah.
so it is important that when you have that acute attack, that you're reaching out because getting started on an antiviral within the first 48 hours of symptoms is super important. So you want to make sure that you're reaching out for that. I'm having a lot of diarrhea too with
Wow.
patients that are really getting this virus, and they're just having lots of diarrhea. So hydration with that is going to be super, super important. But it is rampant. It is rampant. I mean, everything we touch, everything. I mean, the doorknobs, your keyboard, like all those things, it's like then you go touch something else and you come back and it's awful. It's just awful. And especially if you have young kids, I mean, they're just little walking petri dishes, right? Because they're in school and all the things, and it's definitely just rampant. And I thought it would be slowing down by now, but it is just not. And everybody is super, super sick and they're really struggling. They're really, really struggling. And then they're getting the secondary bacterial infection. So they're going through some viral stuff. And then they're coming back saying I have all this green stuff and my chest is full, and so it's turning into just a monster.
Yeah, it really is. So last week and over the weekend, I made, I don't know how many house calls with patients that were doing just that. They had had a little bit of flu, upper respiratory virus stuff, and then 7, 8, 10 days later, they were down for the count. They had junk in their chests, coughing up nasty crap. Their chests were heavy. They couldn't keep, I mean, it was just awful, but secondary bacterial infections. I hung a few IVs on my patients, made several house calls. People were just sick. So yeah, hydration is the name of the game, trying to keep yourself very hydrated. So having said all that, as we've scared everybody to death, um, lots of information about preventing the infection before you've been exposed. So let's talk about that first. And then we can kind of talk about, what to do when you do get sick or if you've been exposed, et cetera, et cetera. So there's a few things that you can do: antiseptic, antibacterial, mouthwash. Guys, I know Nicole just said children are petri dishes. So is your mouth. I don't mean that to be ugly, but gargle twice a day. Don't swallow it. Gargle twice a day with a good antimicrobial mouthwash. Choose a mouthwash that contains chlorhexidine. Um, you can look this stuff up, combinations of eucalyptus, menthol, thymol, uh, something like that to really, really clean your mouth out, gargle, spit it out. My mom was always really hype on the warm salt water with a little touch of vinegar. We would gargle with that and spit it out as kids. And that just keeps anything that is not supposed to live in your mouth out of your mouth so you don't inhale it, continue to breathe it, swallow it, and get yourself ill. Vitamin D, y'all have all heard me on my functional medicine soapbox talking about keeping your vitamin D levels, towards the high end of normal. That presents a higher serum concentration level to keep you healthy. Vitamin C, the recommendation is about 500-ish milligrams twice a day if you can. Zinc, anywhere from 20 to 50 milligrams a day. That helps to boost your immune system. Melatonin, elderberry syrup, supplements, gummies. Be careful with gummies. Sometimes there's a lot of sugar in those guys, so be real careful with the gummies. But if you take elderberry in any form, syrup supplements during high periods of transmission of these types of viruses, you're going to start to see that it'll help increase your immune system, boost your immune system, um, to make it be able to fight these things off a little bit easier.
Yeah, be
Um,
sure to brush your tongue too, or get a tongue scraper. Those work amazing. The tongue scraper, I tried it for like the first time. I hadn't done it in like probably a decade. I did it the other day and I was like, well, that's
Ew.
nasty.
Yes, the first time you actually do it after a while, you're just like, oh, that was seriously in my mouth. Ugh. Um, One of the things that I found really interesting when I was doing some research was one of the preventions that they can use, that they call to use, is 1 to 2 cups of caffeinated or decaffeinated coffee per day. Coffee.
I'm on that. I'm all over that.
I'm pretty sure I just got permission to drink coffee all day. I know it said 1 or 2 cups, but more is better, right?
Oh yeah, more is always better. No.
More is always better. And then, of course, ivermectin, and there's a ton of research out there about ivermectin. We've talked about it just a little bit. Um, and there's a lot of information about there in abundance about natural immunity and how to use that medication to help boost your immune system. And even what ivermectin does on the cellular level. I could bore you to death with the science behind it because I think it's fascinating. Truly, I think it's fascinating. But that medication does some fascinating stuff on the cellular level, and what it can do to cells that are aggressively attacking your body is just incredible. It really is.
Absolutely,
Uh,
absolutely.
yeah. And the interesting thing about a lot of this stuff is most of these are things that we probably should be doing anyway, right? Like we should be brushing our teeth at least twice a day. We should be using mouthwash when we brush our teeth a couple times a day. We should be brushing our tongue. We should be taking these supplements to stay healthy, washing our hands, etc. Um, and so after you've been exposed, Nicole, what do you recommend patients do to prevent infection once they know they've been exposed?
Definitely, if you're not up to par on your vitamins and your elderberries, definitely jump on that right away, right away. Um, Cleaning everything, like Kelly said, don't add to the mix. Trying to get everything as clean as possible. Um, and then just making sure you're keeping moving, keep those lungs working, right? It's when we're sedentary that the fluid likes to settle in our lungs, and that's what leads to pneumonia. That's why a lot of hospital patients get pneumonia, because all they do, you're laying in the bed, right? You're attached to all these monitors and you have a bed. And so patients get pneumonia in the hospital because they're not up moving around. And so keep moving. Even if you feel kind of crummy, you're starting to feel crummy, keep moving, work those lungs, add the Mucinex if you can, if it's okay with your prescriber. Um, you always want to make sure everything goes well with the current medications that you're on, but keeping what's in your chest thinned out. But if you've been exposed, reach out. If you've had a direct exposure, reach out to your healthcare provider, see if you can get a prescription. If your partner, like she said, if your partner tested positive for influenza, go ahead and get on it. The sooner the better with those antivirals.
Yeah, for sure, for sure. I think something else that people don't consider is that sleep is incredibly important when you don't feel good. That's your body's time to recover. Your body's time to repair itself, to fight off infections when you're sleeping. That's why you find yourself, laying around, laying in bed, laying on the couch. And like Nicole said, again, that's when pneumonia can settle in. So it's almost like it's working against you. Yes, we want you to rest. Yes, we want you to lay down. And we certainly want you to get plenty of sleep because that's when your body can care for itself. But again, that's that fine balance between, keeping things moving around and getting plenty of rest. So
Yeah. Yeah.
that's all I have. Nicole,
Yeah,
do you
that's
have anything
good.
to add?
No, that's it. That's good. Short and sweet. We don't want to make things too complicated. Take the long way to the bathroom, do one lap around the house, per day, whatever you can do to keep those lungs moving. Otherwise, I hope you guys stay safe and
Yes.
let us know if you guys need anything. You can find me at hamiltontelehealth.com and you can find Kelly at,
ChariHealth.com, CHARI health.com.
all right, reach out to us if you need anything. We'll see you again.
Bye, guys.